seminar for weight loss surgery. My name is Jesse Gutnick. I'm one of the bariatric surgeons here. I'm joined today by Karen Schulz, who's one of our advanced practice nurses in obesity medicine, and also with Jamie Sarver. Dr. Wilson couldn't make it today, so the three of us will take over her part. Just to give you guys a sense of what we're going to talk about over the next 30 to 40 minutes is we're going to start off by hearing Jamie's weight loss story. We're going to talk a little bit about the science of why weight loss surgery works, the safety profile, what to expect in our program, and then open it up for the Q's and A's. As a reminder or an instruction, submit any questions you have via chat. We already have a couple. Send them to all panelists so that we can see them. Please feel free to start submitting them during the presentation, and then at the end, I'm going to moderate a Q&A session. And with that, I'm going to turn things over to Jamie.
Hi, everybody. Thank you so much for joining us, and Happy New Year. My name is Jamie Sarver. I am a nurse and the program coordinator for our Bariatric and Metabolic Institute. And I also am a patient here in our department. I've been taken care of by this team for about 5 years now. And so I'm just excited to kind of share my progress and my story of just my overall weight loss journey as I've been an employee here and a patient. So if you look right here, I like to start with this picture. This was me September of 2019. I'm right there in the center. And that was pretty much at my highest weight of 253 pounds. And so we'll fast forward to some other slides to show my changes throughout the years. So the slide on the left with me in the green shirt is actually 1 year post-op of bariatric surgery. That is a picture of me and my surgeon, Dr. John Rodriguez. He now works at the Abu Dhabi Cleveland Clinic, but I like to catch him every year to try to just kind of showcase those post-operative milestones. So you can see 1 year post-op and then 2 years post-op, and then most recently with him at 3 years post-op, just the changes in my weight throughout this journey. Next slide. So I also like to kind of talk a little bit about some of like my personal information of why I chose to have surgery, and then also just the actual like day of surgery kind of stuff. So prior to having bariatric surgery, I was 34 years old at the time. And as I mentioned, my highest weight was 253 pounds. I really did not have any like significant we call them comorbid conditions. So I didn't have like hypertension or diabetes or anything like that. I did primarily have PCOS, also called polycystic ovarian syndrome. And it was pretty significant where every single month I was really struggling. But I also had a family history of obesity, and that was actually even more pronounced because my mother's side actually developed diabetes, type 2 diabetes, as they got older. My mom got older and her mother had type 2 diabetes. And so I knew that this was potentially something that was coming if I didn't try to make some changes. I had also considered bariatric surgery for quite a while. So even before I even started working in this department, I knew that bariatric surgery was an option for people, but I did not know how to even kind of attain that. It was just something that was out there that I knew of, but I didn't know if I would have insurance coverage for it, and I didn't know if this was something that would be good for me. And everything that I had ever heard, like my BMI was on the lower end. And so I had a lot of times people say like, oh, you don't need bariatric surgery. You just can diet and exercise and lose weight. And so for me, it was kind of something that was just always like a passing thing. But I really had done diet and lifestyle interventions for a long time. Like all of my adult life, I had been working to try to like lose weight, and nothing was ever working, or I would lose about 20 pounds or 30 pounds. And then I would slowly start creeping back up, or I would have like a long pause where I couldn't lose any more weight. And so once I got to my highest weight of that 253 pounds, that's when I was like, I am done dealing with this. I'm 34. I need to take control and invest in a change that I'm going to be able to make last more permanently. So on December 13th of 2019, I underwent the gastric bypass. My weight the day before surgery was 233 pounds. In some of my other slides, you'll see some of those changes. I had also started doing taking some medications that were helping me lose weight and doing some things to like try to get some of that weight off before I actually underwent the surgery. So my current weight now is about 125 pounds. I fluctuate a little bit, but I'm at the point now where I know I fluctuate between the 120 and 100 and even 30 pounds. And I don't look at my scale anymore on a regular basis to like count those 1 or 2 pound differences in my weight. My time in actual surgery was about an hour and 20 minutes. And that's from the time that they actually took me back into the OR and put me under anesthesia, and then they woke me up. I was in the hospital for a total of a day and a half. I went home. This is pretty consistent. Some people go leave earlier than me on the day and a half, and some people maybe need an extra little bit of time. It's not a race to get out of the hospital. It's really to make sure that you're able to take in your fluids and you're, able to have a bowel movement, that kind of normal surgery kind of stuff. My recovery post-operatively, like right after surgery, you have like that initial like, oh my gosh, I just had surgery on my abdomen. And so there was about 3 days of like, I was really being consistent, taking the pain medications, and really like just being careful with like moving around and it was a little difficult to like move forward or like sit up, those types of things. But I was actually really able to move and walk pretty well within that 3 days. Once the 3 days kind of surpassed, I was pretty much just taking Tylenol as I needed it. And if I was having any like real pain from being up and walking around for too long, then, I would take the pain medications as needed. But it was pretty manageable and tolerable as I recovered. I went back to work in about 4 weeks. That is our typical time off for recovery, and that really is important. There is some flexibility on that, but it really was important to start establishing new habits and new routines, and really kind of like learning to like understand my body and those anatomy changes, and really start making sure that I'm focusing on getting my fluids in, focusing on taking my vitamins, and just, those new routines that are really important. It really was important for me to make sure that I took that time off. But once I did go back to work at that 4-week mark, I've never had a problem since. I've been completely fine in the 4 years that I've been post-operative. Next slide. So I like to show this slide too. My overall like time as a patient with the Bariatric and Metabolic Institute. I feel like it's important for me to share this to people. So you can see starting over on the left-hand side of the screen, it starts as of January 2018. And I really did try to work on some weight loss. That's that first little dip. I wasn't a candidate at that time because I didn't have insurance coverage for the bariatric surgery yet. And so I just worked on the diet and lifestyle and even some medication changes. And you can see I lost weight. But I, again, started creeping back up to that higher weight again. And once I got to that 253 pounds, I was actually eligible at that point from an insurance standpoint to actually move forward with having bariatric surgery. And in my mind, I was like, okay, I gave it one last solid effort to try to lose weight. And you can see I've gained that weight back at this point. Once again, that's the thing that was the theme of my life. And so I'm going to move forward. I did start working on doing some surgery, some weight loss prior to surgery. And so you can see right before that surgery arrow, my weight started to kind of go down a little bit. And then you see the most significant and drastic weight change between surgery and that 6 months post-op. That is where the majority of your like rapid weight loss occurs. And then beginning at 1 year post-op, you kind of start to like level out, and your weight loss slows down. You still lose some more, but between that 1 and 2 years post-op, I stayed at the same weight. There's going to be some more slides that I'm going to show that I actually wound up making some changes in myself because I noticed like I hadn't lost enough weight for what my goal was, and I felt like I could do more. And so I really started implementing some changes, and that's how I was actually able to lose additional weight and get down to this 125 pounds mark that I'm at now. So next slide. Before I talk about any other weight changes that I made, I also want to talk about those post-op milestones that are really important. Those are like the important things like that first year that they're going to stand out to you and they're going to be noticeable. And it's important to kind of like that first year is the year where anything like all of those types of things, you're learning your new body essentially. So I'll just highlight some of those things. From 2 to 4 weeks post-operatively, you're primarily on a liquid diet. You're really not able to eat anything up until I think I took a bite of a popsicle and some Jello when I was like 3 weeks post-op. And that was really the first time I had even thought like, oh, I'm going to try to eat something. But I didn't want to even eat anything. So protein shakes is your main nutrition source during that time, and it can be boring. There's no variety. You just kind of get sick of them at that point. But you know that you need to have those so that you can continue to maintain your nutrition status and not get like malnourished or dehydrated, that kind of thing. I also, during this time, like I had mentioned before, I was really working to try to make sure that I was establishing new routines and new habits. So you want to make sure that you're working to reach at least one of your goals, either the protein goal or your water goal. Usually everybody is told like you need to have, at least 64 ounces of water a day. That's pretty like the norm. But everybody is also given a protein goal. And that is something that is a calculation that the dietitian works with you on. And they're going to give you like your specific, like how much protein you would need. And so it's really important to try to hit at least one of those two goals, if not both, on a daily basis. During that time, I also was really working on trying to make sure that I was like doing things to get moving. That's really important. Just in general, after surgery, getting up and moving, that's going to help everything. And so I, right from the start, was moving and trying to be as active as I could be, knowing that, I did just have surgery. I'm not cleared to like do heavy lifting or weight training or anything at this point, but I sure can walk around and do some stuff. And my surgical pain, by the time I was 2 weeks post-op, there was nothing really there. It was really more of just a matter of like, I need to be walking. If I overexerted myself and maybe didn't get enough nutrition or protein in the day, then I felt a little tired, but there was nothing really stopping me in terms of surgical pain. At 1 to 3 months post-op, this is when you're really actually like, you've made those changes. You've gotten in a new routine. You're hitting your protein and water goals daily. You know that you know when you've made a mistake or like not been keeping track of your protein or water for the day if you're not getting those goals. Your weight loss at this point is not just noticeable to you on a day-to-day basis. I mean, I would wake up in the mornings and start getting ready and I'd be like, oh my gosh, my stomach is flatter than it was yesterday. This is crazy. And so even seeing my coworkers like on a daily basis, I would come in and I would see them the very next day and they'd be like, your face looks different just from 1 day ago when I saw you. So that weight change is really noticeable to other people at that point even. And then the activity level. This is when that 1 month post-op is when I started actually going back to work. And that is like the key time where I was like, I'm already noticing it like 1 month post-op, that my activity level is completely different than what it was just a month ago. Being able to be on the floor, be on my feet, standing up, walking up and down stairs. I was not winded. I was not having problems in terms of like my feet and my joints weren't hurting. I wasn't coming home like, oh my gosh, my feet are killing me today because I just, being on my feet all day as a nurse, that was a significant amount of pain. I was pretty much taking ibuprofen on a regular basis because my feet were sore. So you really started seeing those changes like right away. At 3 to 6 months post-op, this is when I try to like tell people like the food thing finally becomes like not as big of a problem. Prior to that, like I said, you're kind of utilizing the majority of your nutrition from protein shakes. And so your diet's very like just not, there's not a lot of variety. It's not fun. You're really eating to make sure you're getting adequate nutrition and not for enjoyment at that point. But once you get to 3 to 6 months, a lot of that swelling that's internal and in your stomach, your new little stomach, that's, kind of subsided. And so then you have the ability to kind of eat a little bit more food, eat a little bit more variety of food. You're starting to advance your diet a little bit more. So your food's finally your friend again at that point. I was still losing weight at a really good pace as well. I would put on like an outfit that I hadn't been able to fit in previously, and I'd be like, oh my gosh, this finally fits me. And then like the next time I tried to wear it, it was too big for me. So you're really rapidly losing weight during this period. And again, my activity level, it just like kept going through the roof. I was like 6 months post-op, and that wound up being in the summertime by the time I was 6 months post-op. And we had just bought a house and we had a ton of yard work to do and everything like that. I was digging fence post holes and things like that around my yard, things that I would not have been able to even consider doing previously, or I would have been really hurting if I had to do it by myself. But my husband would come home and find me digging fence post holes in my backyard. So I really, the activity level had really significantly changed by that point. At 6 to 12 months post-op, you've kind of reached that like end of that rapid weight loss, but you're still, like I said, it's starting to slow down a little bit. I was consistently meeting my protein and water goals. I was either alternating a protein shake or I was having something else that had high protein in it, like a protein bar or something like that, just making sure that in addition to whatever food I ate for the day was equal to my protein goal. Minimal cravings were noted by this point. Like even still to this day, there can be cake or donuts or snacks or cookies or all of those things that like previously, like that would fester in my head where I'm like, oh my gosh, I know that my office mates have a birthday cake over there. I'm going to go and have another piece. That kind of thing. I started noticing right at 6 months that I was not having those. I was not like there. We had a birthday for my son and an entire half of a cake went bad. We had to throw it in the garbage because it just sat on our kitchen table and nobody wanted it. And so that was really noticeable at that point for me as well. At 6 to 12 months, you're also starting to really become comfortable with those anatomical changes. So like, if you ate something you maybe shouldn't have eaten and it maybe sits in your stomach a little funny or makes you not feel well, you know what you did by that point, and you're kind of comfortable and you just know what you should do and what you shouldn't do in terms of that. And then also by this point, my confidence level had completely changed. In work and even in my friendships and things like that, previous to that, like I have always been an outgoing person, but I could tell that I wasn't trying to shy away from things as much. When by this point I was actually ready to just kind of be like, oh, this is what I'm doing and I'm fine with it, and I will speak my voice on this. And I wasn't concerned with what other people thought, especially when it came to like my clothing choices and that kind of thing. I felt a lot more confident in what I was doing. In terms of intimacy and my relationship with my partner, I know there are some people that they kind of struggle, like my husband doesn't want me to have this, or my family doesn't want me to have this. And I'm the type of person where my husband did not think that I needed bariatric surgery either. He was in love with me, with no problems in my weight. But I knew that I needed to do this for myself and make an investment for myself because I did not feel good. I was feeling mentally inhibited by my weight. I was feeling mentally broken down by my weight. I knew that there was possible other diseases and things like that that were going to be coming to me as I got older, and I didn't want to struggle with that anymore. And so my husband was very supportive at that point, but he also kind of gave me like a little bit of bounce back, like, are you sure you really need to do this? And I did have to say, like, no, I'm doing this for myself because I need to. This is what I need to make myself feel better about, my life. And so afterwards, though, he just absolutely, like, even to this day, like, when we'll be out in public and we're seeing somebody, I had surgery over COVID. And so when we're seeing people that we haven't seen in like 2 or 3 years or something like that, he'll be like, look at Jamie, look at how good she looks. Doesn't she look great? And so for him, that was a huge change because he noticed my confidence level changed. He noticed like all of these different types of changes that were like amazing to him to see. And then also even him, he felt like I need to make a change he needed to make a change in himself to kind of just get to my level to like better ourselves as a team. And so we've really both, even he has lost a significant amount of weight in just seeing what my transformation was. And then I lastly like to just comment on like non-measurable goals. There's things that I could not have imagined that were affecting me, like getting out of bed or getting up off the floor or even buckling your seatbelt in your car. And where you're just like, oh my gosh, like I didn't realize how much of a burden this was for me prior to bariatric surgery, or, painting your toenails with the women and the painting your toenails. Now I don't even think about things like that, but it's, very noticeable and recognizable at that 6 to 12 months post-op once you've had that significant weight change. Next slide. Okay, so now that I am well past that 1 year post-op period, and we do get patients that will come back and they've either not lost as much weight as they wanted to or had hoped to, or they've maybe regained some weight. And so I get asked now a lot, like, how have you been able to maintain and also lose some weight? And so for me, I like to share that because that piece is really important. You did all this work to make an investment in yourself, and now you need to keep that investment. We can't, 100% keep that investment for you. You have to still work at it every single day. So I am mindful of the sugar and the protein and the water intake every single day. I still to this day have either a protein shake or a protein bar or some sort of like high protein yogurt, something like that, to make sure that I'm getting my protein in. I also make sure that I'm getting my fluids in on a regular basis every single day. I know I can actually feel when I haven't gotten enough protein. Sometimes it'll be like I feel a little tired or I'm feeling sluggish, and I think back and like do like a diet recall, and I'm like, I literally sucked at my protein today or yesterday, and I need to, do better today to make sure that I'm getting those nutrients in. And then I also am a firm believer now in exercise. I know that if you see a provider and they're like, you need to start exercising, it's great. That's great. But there is truth to that. And even me prior to having to learn that myself, I was one of those people that was just like, oh, I had the gastric bypass, I'm losing a bunch of weight, I don't need to exercise, this is fine. And you'll see on one of my slides coming up, I love this picture, the difference in exercising versus not exercising post-operatively. And then some other important things are continuing your vitamin regimen. For me, that was not a change. I was taking vitamins before I had surgery, and I still take a vitamin every single day. I actually have a cup right at my desk that has my vitamins in it, and I look at them like they're little fruit chews, and I just take them as like a little, it's time to take my vitamin for the day. And so that did not affect me. And then the last thing that's really, really important, being a provider here, is keeping up with your post-op appointments. I don't know how many times I will talk to a person that they maybe had surgery 5 years ago or 2 years ago, and they had the surgery and they're like, bye, see you later. And they never showed back up. And then they finally come back when they have a problem or they've gained all their weight back again. It's a lot easier for us as providers to help you lose 10 to 15 pounds, or recognize some changes maybe you need to make when you've only gained 10 to 15 pounds, or when you've kind of stabilized on your weight and you're not really moving any further and you think you should be, we can make recommendations and try to help with that. But when it's a lot more difficult for you and for the provider to help you reach that weight goal when you've come back 5 years later and you're back at the same weight that you were originally. And so keeping up with your post-op appointments is such a valuable thing that people tend to underestimate. And me working in this department, I try to make sure I let everybody know, let's go to your post-op appointments. We want to see you for the rest of your life here. So next slide. This is the best slide. Oh, you skipped it. Okay, so this is why I say exercise is so important. You can see the picture on the left is me in the summer of 2020. So that was literally 6 months post-op, and I was riding that like, I don't gotta exercise. I'm already down to 165 pounds and I feel fine and everything's great. Well, then once fall started hitting and I got past that 6 months, I really noticed like that plateau is happening to me and I'm not losing as much weight and I'm not really toned and what am I doing? Because it is the summer and I've been active, but I've not been doing any kind of structured type things. And so that's when I really recognized like, okay, I have literally been lazy about this and actually doing some structured exercise. And so I started doing weight training within my house. I don't have a gym membership. I've not had a gym membership this entire time. I had a rowing machine that I bought, I think the year before I had surgery that it just sat there. And so I started using the rowing machine. And then I also started doing free weights. 2 to 3 days a week, I was doing like 20 minutes of the rowing of cardio and then like 40 minutes of weight training. And even when I say weight training, I would sometimes even like be so excited that I would like, when I would go downstairs to wash a load of clothes or something like that, I would go over and do a few reps of free weight training just to add to that benefit that I was already doing the 3 days a week. But you can see a difference. Like, it's amazing to me looking at this picture and seeing the first time in 16 years of my adult life, I actually have like biceps and like you can see I have ab muscles. And for me, that was the first time that I was like, I can finally actually see that exercise helps. Previous to that, prior to bariatric surgery, it didn't matter if I exercised or not. I never even noticed any changes. And so for me now, that has made me a firm believer in like, you got to continue to exercise. And now there's incentive because you can actually see the difference and see what kind of difference it makes in your body and your tone and all of that kind of stuff. And it makes you feel a lot better and builds your confidence. So hopefully you enjoyed my story. And I'm open to answering any kind of questions you have related to bariatric surgery and my story or however I can help you.
Thanks, Jamie. And that last slide is my favorite one. It just shows, and I don't know if you mentioned it this time, I think we've definitely talked about it. I think you said before that it's not like you had never exercised before.
Yeah, no.
But it had never been as effective.
Yes,
exactly. And all of a sudden it was.
Mm-hmm.
And I think that's a really great lead-in to the next section, which I'm going to talk about, which is why and how it works, because it does change how your body responds to what's going on. The analogy we use is the concept of a weight thermostat, and similar to a thermostat in your house, especially today, right? You've got it set on heat because it's cold outside, and if the temperature drops below that weight, below that temperature, your heat kicks on and it kicks you back up. And when you're dieting or trying to do things to lose weight, your body fights that weight loss, and that's not a bad thing. If you think about how we evolved as human beings, right? We mostly lived for about 100,000 years in a situation of at times extreme scarcity, where you'd have limited food supply, let's say over the winter. But in our current situation, that's not as helpful. And so as you try to lose weight, your body hormonally responds to it to fight that weight loss. And weight loss surgery essentially reprograms how your body manages not just your caloric inputs, but also your exercise inputs. And so many people have said, I've always Jamie's not the only one, weight loss has become much more effective for me in terms of doing those other things that are supposed to help you, like exercise, in addition to what you're eating. So how does this weight loss thermostat work? Most importantly, we have a thing called our basal energy expenditure. That's how much calories we burn just sitting here like I am talking to you, not doing a significant amount of exercise. Most of the calories we use on a daily basis are for what we are used, or it's called our basal energy expenditure. So when you're dieting, that number goes down. Our bodies turns down the furnace, as it were, to burn less calories on a moment-to-moment basis. After bariatric surgery, that increases. So even when you're not exercising, you're using more calories just to maintain your regular body functions. Your sensation of hunger decreases after surgery. It obviously increases when you're dieting without surgery. Your sensation of fullness decreases when you're dieting, increases after surgery. When you're dieting normally, your stress response and your stress hormones go up. And after weight loss surgery, it's very conclusive that those decrease. And then there's some specific hormones that have been linked to how we manage calories, how our brain senses satiety, and which are listed down here, including ghrelin, GLP-1, PPY, circulating bile acids. The main surgical, or the most common surgical options are sleeve gastrectomy and gastric bypass. I'm going to focus on those when I go through some of the research, because some of the more elegant research studies have been done on those operations. Some other potential options are duodenal switch surgery, Sadie surgery, and revisional or corrective surgery. You may be familiar with these. On the right-hand side of your screen is the gastric bypass. Essentially, it's a stomach bypass. Gastric is the medical word for stomach. So we make a very small stomach out of the top of your overall stomach, bypass the rest, and then directly connect that to your small intestine. The sleeve gastrectomy is an operation that's done only on the stomach, and you can see in this picture it almost looks like a sleeve when it's done, where it's got a seam down one side, like a long sleeve shirt has a seam down one side. And so that kind of creates a restriction and some hormonal response, although less than with a gastric bypass. One of the most foundational and groundbreaking studies for weight loss surgery was done here at our institution. It's a little bit older now. We're getting close to being able to get up to even for a 10-year outcomes paper probably, but this is the 5-year outcomes. And this was a randomized controlled trial in patients that were diabetic. Now these patients were selected so that this not only looked at weight loss, but also looked at how weight loss surgery treats other conditions that go along with weight. And diabetes is one of the most important of those because of how damaging it is. And so that's why this was studied in diabetics. And in this randomized controlled trial, patients were randomized to being treated with sleeve gastrectomy, gastric bypass, or best medical care for their diabetes, and their outcomes were compared. So if you look at this graph, on the left-hand side is the change in the BMI. If you don't know what that is, it's just a ratio of your height to weight done in kilograms. And so a change in BMI over this time, and then at the bottom, it's how many months following when they were determined they would undergo sleeve gastrectomy, gastric bypass, or best medical treatment. You can see in yellow is the best medical treatment, and these patients had a couple of BMI points down, about 2 points down on average. And then if you see the average lines for sleeve gastrectomy and gastric bypass, they have significantly more weight loss. In this study, about 10 BMI points for gastric bypass at the lowest, about a little bit less for sleeve gastrectomy. This is slightly less than you probably see overall for these operations, but sometimes people with diabetes have a little bit of a less response than if you look at all comers. Similarly, and like I said, this was done in diabetics. They were looking at the response to surgery for the diabetes. And so these patients with the best medical therapy had a decrease of almost 2 points in their A1C, which if you're a diabetic or no one, you know, this is how we track how severe your diabetes is and how the treatment is going. Whereas the patients with gastric bypass and sleeve gastrectomy had a drop in 3 points or more at this time. And so this was quite effective. And the reason I bring this up is this is one of the most measurable and one of the most important health issues that goes with obesity, but there's so many others. And sleep apnea, asthma, heart disease, high blood pressure, migraines or headaches, and other structural issues. And the idea is hopefully we can prevent this if you have weight loss surgery before you develop these, but really to stabilize or reverse those health issues. I'm also going to go through the safety profile. The way that I measure safety, and I think the way that I think about safety, and most people do when they're thinking about weight loss surgery, is not only what are the risks and benefits, not only what are the risks and benefits of surgery, but what are the risks of not doing surgery, and how do you compare those? And there's really two important components in that. One is what are the risks of surgery, and those are small, and what are the health benefits over time? When it comes to the risk of surgery, weight loss surgery is one of the fairly newer fields within surgery. It's been around since the 1970s for the most part, a little bit in the 1960s. And much early, all of surgery at that time was riskier, but weight loss surgery in particular was back in the 1970s. Throughout the 1990s, 2000s, there's a revolution in bariatric surgery of two things. One was the introduction of minimally invasive surgery, which enabled much lower impact, physiological impact to you compared to old-fashioned surgery with a big open incision. And one was the development of subspecialty training programs in bariatric surgery. And so you can see in this graph throughout the 2000s, the risk of death went from 4 in 1,000 to well under 1 in 1,000. And it's continued to drop at almost the same rate. Of course, you can't make improvements as quickly the lower you get, but it's continued to drop in the decades since then. So today, the risk of mortality is less than 1 in 1,000, or 0.08 risk of mortality. When you look at the safety of weight loss surgery compared to some other common operations, this was again compared in diabetic patients. The reason why is if you have diabetes, you are at a higher risk of problems or issues around the time of surgery from your diabetes. And so this sort of amplifies the effect so that you can see the difference. You compare at the top some other kinds of surgery. So heart surgery or a CABG, that's like a cardiac bypass. The risk of complications is 46%. You go down to more common things like a knee arthroplasty, that's a knee replacement. The risk of complications is 16%. Some more types of abdominal operations like hysterectomy, 3.5%, gastric bypass, 3%. That's any kind of issues whatsoever in terms of within 30 days. Now on the flip side, what are some of the most important ways that weight loss surgery improves your health? And so you can compare patients that had usual care versus weight loss surgery, again, who are diabetics, at some heart and vascular outcomes, just as one subset example. So if you look at this graph, this shows it. If you have non-surgery, this is in the yellow line, this is the incidence or over time, the percent of people that have cardiac or vascular problems. And by 8 years, it's climbed up over 15% without surgery. Now with surgery, and remember these are people with diabetes, so they have a higher risk of these, that is under 10% at 8 years. And so that's sort of decreased heart failure, coronary artery disease, arrhythmias, stroke, kidney failure, etc. So in short, the risk of surgery are very low. They're not zero, they'll never be zero, but they continue to be lower and they're very low. And the long-term benefits are enormous. By treating sleep apnea, treating diabetes, improving the safety of childbearing if you're of childbearing age as a female, improving your quality of life through improving joint pain, decreasing the risk of certain cancers. This, now that patients are, as I had said, this has been around since the 1970s. Now that they're moving into, over 50 years from the earliest ones, we've been able to see that it decreases the risks of certain cancers and more. And with that, I'm going to turn things over to Karen Schulz, who's going to talk about some specifics about our program.
Okay, thank you, Dr. Gutnick. And thanks to all of you for being with us this afternoon and taking this first and important step to learn more about weight loss surgery. So I am one of the advanced practice nurses and also administrator in the program. So I'm going to talk a little bit about being a patient in the program and what it would be like and the next steps after today. We're getting a lot of questions about that. So first, I want to say that our program delivers care as close to home as possible. In fact, in your home, for all or most of the program, with the exception of surgery. Of course, we always like to see our patients at least one time in person, but we also know sometimes traveling is difficult, especially if you're from out of town. So we do have extensive virtual visits for all of our appointments. It does require that you have access to MyChart. So if you don't have that yet, that would be a good first step. We also have regional access to the program with 3 centers of excellence centrally at main campus. We also have an outpatient clinic there. On the west side, we do surgery at Fairview with outpatient clinic in Avon and soon to be in Westlake. And then out east, we do surgery at Hillcrest with the outpatient centers in Twinsburg and Mentor. Next slide. All right. We thank you for choosing the Cleveland Clinic. We know we have lots of great choices in this area for healthcare, but you can see that we are highly rated nationally at both our main campus and in our regional sites. And that's by U.S. News and World Report. Next slide. Okay, I saw some questions in the chat about, what is next and how hard is it to get through the program. So we try to make it as easy as possible by helping navigate you to your goals. So it starts with watching an online seminar. And following that, there are a few questions, including information to fill out about your insurance. And then each paid person will be assigned a patient navigator. And we do have 5 of them. They're divided by the alphabet, and they will be your guide as far as financially figuring out what, first of all, do you have coverage for bariatric surgery? And if yes, then what do they require? Okay, some insurance companies require that you be with us for 6 months. Others do not. That's just one example. So they're going to make sure you know exactly what your responsibility is and if you have coverage. There'll also be a resource for you to help you coordinate appointments if you need it, and answer questions along the way. Next slide. Oh, one more back. Okay. So actually my favorite part about this program is our team. Okay, in addition to that navigator, we have a very large and specialized group. So you really do have your own team that will be taking care of you. So for example, we have 9 bariatric specialty trained registered dietitians. Okay, you'll have 1 or 2 assigned to you. Each person has their own obesity medicine provider. Okay, we have 3 physicians and 6 AP advanced practice nurses, including me. Our job is to make sure that you have a medical evaluation, that you are in the best shape possible to undergo an operation, an elective operation. We can use any testing that you've recently had. You don't have to repeat things that you've already had. We can work with your specialists if you have physicians, or we can start from scratch if you haven't seen a doctor in a really long time. We also have bariatric psychologists, actually 8 of them, that will help to make sure you are healthy, but both emotionally and psychologically. We know that food plays an important role, not just in feeding our bodies, but also in handling emotions. So we want to make sure you're ready for those types of things. If you already have a mental health care provider, we can work with that individual. In fact, it's important for us to have them on board as part of our team here. Then, of course, we have bariatric surgeon, all fellowship, specially trained surgeons between all of our sites. We have 12 bariatric surgeons. And then consultants, anything you could possibly need as far as sleep medicine, cardiology, endocrinology, pretty much every resource that you can possibly imagine we have available at the Cleveland Clinic. Okay, so next slide. I think that's my part. And we'll move on to the Q&A.
And thank you everybody for sending in questions. We're going to get started with the ones that have been submitted. Feel free to send in some more. Remember to send them to the chat and I'm going to ask them to the panel. Just as a reminder, because many of the questions are always about next steps. So if you just Google Cleveland Clinic Bariatric Surgery, watch the seminar. It's, in addition to this one, it's a lot more detailed and covers some other information, so that is recommended. You fill out a short questionnaire that registers you. That registration checkout triggers our navigators to check your insurance so that they can contact you and let you know what your specific insurance requirements are. And schedule and call you to set up a first appointment in your journey. So with that said, I'm going to start asking some questions. I'm gonna bunch some of these together as well because there are some similar ones. First one I'll say is several people have asked, and people always ask about Florida. All of the scientific information we've talked about, Jamie's story, that all holds true because of course that's just about weight loss surgery in general. They're a separate team because they're down in Florida. So please just reach out to them through their website is the best way to do it. So all that being said, just briefly, because we often do have a lot of people that are employees at Cleveland Clinic. Karen, are you able to just briefly say some of the little differences about Cleveland Clinic requirements?
Yeah, sure. So the good news for Cleveland Clinic employees is we do have coverage in our plan. You will need to be employed and part of the health plan for 2 years prior to applying for bariatric surgery. The first step would be registering on the EHP site with your case manager in that case management program, because they do require that you're signed up, and many of you probably already are if you're on the STEPS program or one of the healthy choice programs, but you need to be on that for 6 months. And the rest of the requirements are pretty much the same. BMI 35 to 39, you have to have a comorbidity, 40 and above. Really all patients are candidates. So they have great coverage, but you do need to be in the health plan for 2 years. You also have to have a body mass index of 40 and above if you don't have any health conditions for at least a year. 35 to 39, one comorbidity, and you have to have that for a year. So they're pretty specific. If you go on EHP, they kind of spell it all out.
Thank you. Jamie, one person asked directly to you, you mentioned that you didn't have, that one of the things you like about surgery is that you don't have some of the cravings you used to have. Can you talk more about that? Is that the same for everybody? Do you do anything specifically to help with that?
So you might be able to answer more of the scientific portion of that, but it's a combination. I think, or I feel, part of me is motivated a little bit more to have more stability in my discipline and more consistency. I also have done a lot to make sure that I'm anticipating how my eating habits are. So my husband and I, like I had said, we made a lot of changes. We food prep on a regular basis. So every weekend, him and I actually will prepare meals like soups or high protein type meals, things like that, freezer meals, so that my food is portioned out with the correct portions. And I'm not like trying to search and hunt for like quick fixes. So I've been able to more consistently maintain like eating what I'm supposed to. But then in terms of like those mental cravings, I do know that when you have bariatric surgery, some of those microbiome changes happen in your gut, and some of your nerves that are, go from your stomach to your brain. There are changes that actually happen with bariatric surgery that do affect that. And so I think it's a combination of all of that kind of stuff. But it's very noticeable for me. It really shut off that like backward, like just kind of constant like thinking about food and what am I going to eat, and there's like snacks and things like that. Like I actually I'll show you, I got a thing of chocolates for Christmas from one of my coworkers, and literally I think I have like a chocolate every once in a while, and it's sitting right in front of my face, and I still have a full box, and I got that before Christmas. And so the changes are real, and they really do happen. And in my discussions with other people that have had bariatric surgery, very similar. It just depends on how strong those types of habits are for you, and your ability, like it'll come back if you continuously like defeat yourself and I'm going to have chocolate every day and I'm going to do this every day. I'm sure that you wind up starting to develop those habits again. But for me, I really pushed to be a little more disciplined because I felt I noticed that difference. And so I was like, I'm going to keep my discipline and be consistent about it. And so for 4 years, I've been able to kind of maintain that, not having those cravings and that brain kind of barrier for food.
Yeah, I mean, I think you asked if I could elaborate on that. And I think it's a combination of different people have different responses to the surgery. So some people have more of a response to less cravings than others. And some of it is, so that's out of your hands. That's just how your body's going to respond to surgery. The other part of most habits has to do with how all habits are, like, you know, the simplest thing being, do you hit snooze or not when you wake up, when your alarm goes off when you wake up? That's a habit that is just more of a behavior as opposed to a physiologic or a hormonal based thing, whether you hit that snooze. And those can be changed. And I think you talked about that very well. That is a combination of the two.
Yeah. One other thing I was going to say, I'm sorry, I didn't mean to interrupt you. I completely forgot to mention that with my specific procedure that I had gastric bypass surgery. And so you might hear the phrase dumping syndrome. And so when you have too much sugar, like I mentioned in my story, that I am very cautious of how much sugar I eat, as well as like the simple carbohydrates that break down into sugar in your body. I'm very careful about that because if I eat something that is too high in the amount of sugar, it can make me sick physically. And so I actually specifically chose that procedure knowing that, and knowing that I'm a cause and effect kind of person. If you do this, then this is going to happen. And so that also has helped to limit how much of the sweets and those cravings and things like that. I've even developed like kind of like food and like I've not been able to tolerate certain things. Like I used to be able to eat ice cream. I don't even try eating ice cream anymore because it makes me sick. So I don't even get a craving to eat ice cream because I know that that's going to make me not feel good and I don't want that. So I've been able to kind of avoid stuff because I utilized that dumping syndrome that you might get from having gastric bypass.
All right, Karen. Common question. What proportion of people have issues or difficulties with excessive skin after significant weight loss? They've had a lot of success, but depending on how they carried their weight, they have some excessive skin.
Yeah, that's a good question, and I appreciate that someone's thinking about that ahead of time because sometimes depending on your personal expectation, it might not be that perfect body that you imagined. I would say the majority of people don't have significant enough skin problems to require plastic surgery. Some people have no issues whatsoever, and they, you think they would, and vice versa. Most of the areas that we see are in the abdominal area, and if it's something that is bothering you, we have a great team of plastic surgeons that can evaluate you. I can honestly say, though, most of that, unless it's causing a medical problem, is not going to be covered by insurance. But some people, just want that extra for themselves. But the minority of people actually require that plastic surgery. Yeah.
Thanks. I'll also ask you the next one. After surgery, is it common to reduce medications like for blood pressure and other things? And who manages that? Karen.
Yeah. So that's part of the slide that Dr. Gutnick showed with all of the health problems that are associated with obesity. I would say, 90% of the health problems either maybe even higher than that, either completely disappear or get better. Okay, and it's impossible to know which ones they will be and who is going to be in that category until you lose the weight, unless you've lost weight before. But for sure, people have, less joint pain, they have more energy. A lot of people have reduction or elimination of high blood pressure. I'd say 99% of our sleep apnea patients are able to not use their CPAP anymore. Diabetes is, I would say, most always better, sometimes completely disappears, depending on how long you've been a diabetic. So yeah, excellent way to not only lose weight, but to restore your health and quality of life.
Great, thanks. A couple of people, I believe, asked about endoscopic procedures. I'll talk about them briefly. I didn't touch on them in specific for a couple of reasons. The first reason is none of them are covered by insurance, so they're not available to the majority of people, unless they want to do cash pay. But I'll also say that the reason that they aren't covered by insurance is that they're significantly less powerful in terms of their weight loss, so they're less effective, and so that's the reason that they're not covered. So the degree of weight loss that and all the studies done on them afterwards is a lot less than after the weight loss operations, and that's to be expected. All of them work only by physically restricting, and they don't have any kind of hormonal component to them. And so what we know from prior surgical restrictive operations is that for most patients, they didn't get them where they wanted to go. So we do have people that do endoscopic weight loss surgery, but this seminar is really focused on these, the sort of the standard procedures that are covered and that are highly effective. Speaking of that, there was a lot of different questions about age cutoffs, which there aren't any, some specific things about you yourself, how much weight could you expect to lose, or other health issues. I'm going to ask some other questions, and while this is on, I'm going to pull up a good website that patients can go to kind of look at a customized estimate of those kinds of things. In that meantime, while I'm looking those up, there's a patient who had prior weight loss surgery nearly 10 years ago, did very well, but did have some weight regain after pregnancy. And Karen, what are the steps for someone that wants to get back on track?
Okay. Well, first of all, I want to say that regaining weight after bariatric surgery, well, it's the minority of patients. It can happen, and it's a variety of reasons. So, the smallest amount of patients, there could be a change in the operation, also depending on where and when you had the operation. So we would probably first have you come back and be evaluated, do an x-ray, maybe endoscopy, see what's going on with your pouch to make sure there's not a physical reason that you may be challenged with some weight regain. A lot of women after pregnancy, their hormones change. They can have some challenges there. And there are a series of behaviors and choices that go along with the operation that make it the most successful possible. So sometimes it's just coming in, meeting with our dietitian team, and reviewing those behaviors and choices, and a few small tweaks with a dietitian can really help start getting that weight loss going. But there's even more than that. So sometimes we use weight loss medications in conjunction with surgery for patients that are gaining weight back. And lastly, if there is something going on with that operation, there are, as Dr. Gutnick mentioned in the beginning, there is the possibility of revision surgery. So, just similarly to if you have your knee replaced and 15 years later, it's starting to have a problem. Sometimes they would revise the knee. That is now that weight loss surgery has been around for so long, sometimes people require a revisional operation for their weight loss surgery. But again, the minority of patients are needing those services, but certainly if that is you and you have some questions there, you would just, give us a call on our main number. And, I can give it to you. You can Google it, 216-445-2224. We'll kind of triage the problem and decide who on the team would be best for you to start with.
Were you able to see my shared
Yes.
browser?
Mhm.
And I just lost. There we go. Okay. So many people have asked about, I have this specific background. What are my risks or my estimated risk or my weight loss that I can have? None of us we don't have a crystal ball because we don't know what'll happen exactly to you. But we have an enormous amount of information about past patients that have had surgery. And all this is collected in what is called MBASQIP. This is a quality database that every accredited bariatric center has to put all their information in. And actually, we don't put it in. There are third-party people so that we can't game the system or anything else put that information in. And the wonderful thing about this is there's hundreds of thousands of uh, patients, not your actual data, but your what's called de-identified data. So just basic information about you, like maybe your height, if you can see here, weight, and I put a hypothetical person in here. So this is a 5'6", 260-pound, 40-year-old woman with diabetes, but not on insulin, who has sleep apnea, high lipids, and high blood pressure. And we can take a look at what the possible outcomes are and what the potential risks are. So the first thing that comes up is your potential risk, your risk factor, and with different operations. But what I want to really, and so you can scroll down here and see what those are. And so in terms of serious risk of any serious issues or not. And this isn't, remember, for our specific location. This is if you look at any weight loss program across the country. But I think really importantly, you can look at your percent total weight loss that you can expect with the different operations, for example. So you can plug your own information in and you can say, well, at one year, if I had the sleeve gastrectomy, on average, I would have a 25% weight loss. Gastric bypass, I have about a 30% weight loss. And if I had a biliopancreatic diversion with duodenal switch, I'd have about a 37% weight loss. By the way, lap bands are included in this, although we don't offer it anymore, and you can see why based on this graph. Most people really did not get to their goal, and that's sort of most of the endoscopic procedures to sort of bring that back up have a similar response, or maybe even less than a response that the lap band had. So this is something you can look at with your surgeon. Some of my patients find this helpful in the decision-making process when we go through these things and sort of calculate it for them in particular. So it's something you can look at. It helps to go over it with your surgeon because they can provide that grain of salt or that, obviously that knowledge and how it might apply to you and your other health issues. But I think sometimes that is helpful if you have a very specific one about you can look exactly at your predicted risk for your particular situation. While we're doing our next chats, I'm gonna pull back up our other website. Karen, someone asked, how do people respond if they have rheumatic joint disease, not just osteoarthritis?
Yeah, I mean, its response to surgery for people with rheumatic joint disease is good. The issue may be if you need anti-inflammatory medications, the surgeon may recommend a certain procedure, namely the sleeve gastrectomy, because those anti-inflammatories will be less irritating to the stomach. But as far as outcomes, people with joint disease, with arthritis, all of those conditions do quite well with surgery.
Great. Yeah, I think the other thing I'll mention is it's really important, not just with rheumatic heart disease, but with a variety of other health issues. And one of the reasons that we have our obesity medicine physicians, because they're very good at looking at this, is sometimes you might be on a medicine that's either promoting weight gain or just fighting your weight loss. Commonly with steroids, if you have rheumatic issues, maybe you can be on a biological therapy that helps that certain other medications, like ones that help with sleeping, may fight your weight loss. And so they'll often identify those things when they're doing that consultation with people. So, Karen, when one person asks, when will a navigator reach out to us, or how do we get a navigator to reach out to us?
Yeah, the first step is to go online, as Dr. Gutnick mentioned, to go to our website, click on the seminar, which is about 30 minutes. It's not required, it's recommended. There's also a questionnaire that you fill out, so that gives the navigator the information they need to check your insurance, because they're going to want to check your insurance to see if you have coverage and see what the requirements are before they reach out to you. And they'll reach out to you either way, coverage, no coverage, and someone will reach, if you do have the coverage, someone will be reaching out to you to ask if you like to schedule your first appointments. Okay, the 4 core appointments are going to be with the surgeon, with obesity medicine, with psychology, and with nutrition. So we proactively reach out to people with benefits to see if you would like to come in.
Thanks. Jamie, you had said that you were back to work in about 4 weeks. Is that typical recovery for gastric bypass? What are the ranges, and how quickly do people typically get back to work?
So I was a nurse at the time. I'm still a nurse, but not working the floor as much. But it really just depends on your job. So my job, it's got a moderate activity level. I have to be able to push, pull, all that kind of stuff, 50 pounds of weight kind of a thing. And so for me, it was a matter of the recommended time was 4 weeks, just because of what I would be having to do. But I do know that, people have discussions with their surgeons. And if you're, working from home, or you are pretty sedentary in terms of your work, then you might be able to get away with doing 2 weeks. The thing that I like to make sure that I just convey to people is that, again, this was something that that 4 weeks, I needed that amount of time to really kind of make those habits, those healthy habits, and really establish those, so that when I did go back to work and I was, stuck talking to patients, or I was, just not thinking of myself, I'm thinking of other people and caring for other people. I've already kind of built in those habits of, like, I need to recognize when I'm thirsty. I need to recognize times when I need to be eating food and getting the protein in, so that I am not running myself to the ground at that point, and then realizing it. So that 4 weeks really helped me to establish a real change in my routine. And so I always say, if you can take that time, take that time. If you can't and you have to get back to work, 2 weeks is a lot of times what the standard can be then.
Thanks. Yeah, I mean, I think it just has to be individualized based on what you're doing. But it's always good to take a little bit of time for yourself, for your own health. I think that since we're heading up on the 2 o'clock hour, I'm going to answer one more question. I think we've covered almost everybody's, if not exactly your question, hopefully one very similar to it. One more person, and this is a really common cause to seek weight loss surgery. How soon after weight loss surgery can I get my joint replaced? So, and this is a really common one. So frequently an orthopedic surgeon will say, you need to get weight loss surgery so that we can fix repair your joint. And the reason why is that they know from their own quality databases, like the one that I sort of took you through that example, that the risk of complications or that joint repair not doing well goes up with a higher BMI. And they have certain BMI cutoffs that they will set for you to do that. And so if you are, and that's just one good example of like a specific health goal that people come in for very, very frequently. So it's not a period of time. It is hitting that BMI criteria that orthopedic surgeon set. And it's very important when if you do have a really specific health goal to lead with that when you're talking with your surgeon and choosing the operation you do, so that you're likely to hit that health goal with the operation that you choose to do. Because as you saw in that example, the different operations have a different likely weight loss that you'll get. You want to choose one that will probably get you to where you want to get to. And with that, thank you everybody for sending in great questions. Thank you to the team for doing this live seminar. If you, any specific things that you want to go over, we can always, of course, go over it during your first consultation. And have a great afternoon. Stay warm.
Bye, everybody. Thank you.